I'm Lori McDonald. I'm the Vice President for Student Affairs, and I'm here today with Dr. Mark Pfitzner, who is the Director of our Student Health Center. Thanks, Mark. I know you and your staff have been particularly busy, and I appreciate you taking some time. Could you just tell us a little bit about the Student Health Center, where it's located, and what services you provide?
Yes, and thanks for having me today. The Student Health Center is located in the MADSEN Health Building that's on the corner of Mario Capecchi and Foothill Boulevard. It's a clinical building that's owned by University Hospital, so there's other clinics in our building. We're located on the first floor of the building, so you go in through the front door and then down the elevator to our clinical space, but that's where we're located.
Wonderful. And your website has quite a bit of information about hours and things?
Yeah, the website is STUDENTHEALTH.UTAH.EDU, and it has, the current start page has information about all the different virtual visits that people can do if they need to, as well as information of how to access care with us. As we are still open and seeing patients, though it's been kind of an interesting struggle the last month in figuring out what we're doing, because we're trying to keep the well people home and the sick people home, and then trying to assist those in between with mainly telephone visits. And we've been transitioning into telehealth visits using the Zoom platform. But for students who have particular concerns about COVID, I think they are welcome to call us, and then we'll help them navigate the system, because we aren't doing that testing within the clinic because we don't want people coming into the clinic who have those symptoms. We're steering them toward virtual visits to the university, and then they'll get the students to the drive-through testing locations that are around the valley.
Great, thank you. So what advice would you give students these days to stay well?
I think try to listen to good, reputable sources like the CDC, the state health department, as well as the university's main, I think it's coronavirus.UTAH.EDU's webpage, to give you kind of up-to-date information of what's going on. Obviously, if you're feeling ill or sick, the best thing you can do is stay home and try to avoid being around others until you are better, or if you need to be tested, have been tested, and then find your results. And so that's probably the best thing to think about, is just terms of just taking care of yourself. And then now that finally the weather's getting a little bit nicer, use this time to get out, walk, enjoy the springtime and the beautiful kind of surroundings we have to kind of help get through this. And then I find just taking some time for mindfulness is particularly useful. I think when this first started, I was finding myself utilizing that quite often to kind of calm down after a very busy day of work. But that's what I probably recommend for the students.
That's wonderful. Well, what type of things, you just mentioned mindfulness. I was going to say, what type of things are you doing to keep yourself well and to help your team out, who are providing such really important services?
I mean, we're trying to do, also, at least for the team at work, most all of us are at work, and I think everybody, in some respects, we're glad to be out of the house and going to work instead of being at home all the time. And so people are kind of having the ability to have those kind of conversations. And so I think as much as you can stay connected with other people and friends and joke about things, I personally enjoy cooking, so I'm finding relaxation in my evening meal planning of what I can do and try to eat healthy, trying to get out, garden, all the kind of fun things you can do in the spring. That's what I'm trying to do. And I think most of my coworkers are enjoying sharing pictures of their pets and all of the other kind of things that they're doing. We're trying to figure out what TV shows that we should be watching as a way to kind of relax in the evening. But that's the main thing I say.
Great. Well, thank you very much. Thanks for your time. Thanks for all that you're doing to support our campus community in this very unusual situation. We very much appreciate it. And I very much appreciate the recommendations, like you said, about very reputable current information. And those websites you mentioned, I know, are kept current.
Yes.
Thank you very much.
Thank you, Laura.